Well, as we have reported after weeks and weeks, knowing that COVID cases and hospitalizations are going up, at least the numbers that the state were putting out are starting to show a decline. The problem is we've had questions about these testing numbers and positivity rates because we don't know what these at-home tests and all that distribution is doing to it. We also don't know how sound the hospitalization numbers are because of the difference now we've had to draw between people hospitalized with COVID versus because of COVID. Well, there's a lot to get to. Why don't we get to Trinity Health of New England's Dr. Syed Hussain to see what he thinks about this. It's been a while, Dr. Hussain. How are you this morning?
I'm great, Tim. Happy New Year.
Happy New Year to you. Yeah, and speaking of years, it's now 2 years since the first COVID cases were here in the U.S. What do you think about these statewide numbers? Do you look at them and see that maybe we are at least past the Omicron peak?
I do. I'm guardedly optimistic that we are. Indeed, we've seen a drop in hospitalizations for COVID-19, including those that are critically ill. So this is promising news, and likely follows the pattern that we've seen in other countries before us that have gone through this Omicron surge.
All right, so that is at least one more good sign. Let's talk about testing here. There's been a big push to get people these free rapid antigen tests, knowing, though, they're not as accurate as PCR tests. The problem is PCR tests take a lot longer to come back. So are there some good guidelines for what tests people should take and when?
Yeah, that's a great question. So let me give an analogy so folks, it's easier for folks to understand. So an antigen test, a rapid at-home test, can be compared to an X-ray. They're fast, they're cheap, they can readily spot any big abnormalities. The PCR test, which is a lab test, is more like an MRI. It's slower, it's costlier, but it's very, very precise. Now, when you have symptoms suggestive of COVID-19, that's when a rapid test is most accurate. That's not to say that you can't use a rapid test. For instance, if you're getting together, there's a large gathering that you're attending, or for instance, we've seen the governor's executive order related to visitors in nursing homes who are not vaccinated. They would have to show proof of a test. A rapid test will basically tell you whether you have the virus or not. And again, the accuracy is increased if you have symptoms. A PCR, on the other hand, which is a lab test, is a very, very accurate test and will tell you, even if you don't have symptoms, whether you really have the virus or not.
A lot of controversy around nursing homes now for two reasons. You mentioned that testing requirement, although it looks like if somebody's willing to take a rapid test and they're not available, these people still will be allowed in to see their loved ones. Curious what you think about that, and then what you think, and I know doctors sometimes are loath to talk about policy decisions, also what you think about the general guidelines about putting some COVID positive patients back in nursing homes, even though there still appears to be some rooms in hospitals for them. What is your take on all this?
So I'll answer your last question first. It's really important that as we go through a surge and we learn from previous surges, that we're able to take care of both COVID and non-COVID patients. You'll recall when we first went through our surge in spring 2020, 2 years ago, we told folks, don't come to the hospitals. We have to take care of these patients, COVID-19 patients who are critically ill. That actually now data shows was not the most appropriate move, because it led to patients delaying treatment, delaying diagnoses for cancer, for instance, and turning up later on with more advanced diagnosis. So we want to be sure hospitals are always in a position to take care of both COVID and non-COVID cases. And that's why you see the pod situation where patients who are improving can be discharged to another facility and make sure that they go through their 5 to 10 day isolation period. Now, when it comes to testing, the rapid antigen test that you alluded to earlier, I do believe this is one additional measure to ensure that everybody's protected in a highly vulnerable environment, and that's senior living, nursing homes and such. So it's important that folks not only get tested, but are vaccinated, and also observe public health measures such as masking when they enter these facilities.
Dr. Hussain, we have run out of time. We want to talk with you again, I'm sure, next week, because these are so controversial. We can get into a lot of the bits and pieces of these policies, especially when with regards to nursing homes. But thank you again for the time you've taken to give us your knowledge today.